my name is Julie with Medical Memory. We're always innovating our tech with features and tools to save nurses and providers time and increase experience scores, all with a simple app downloadable on any smart device. It's easy to use by any modality, quick to train and scale simply. If you haven't seen the innovation of Medical Memory in the last 6 months, then you're missing the huge opportunity the tech provides. I'm excited to show you how our tech has evolved. A simple app is allowing nurses to communicate more effectively with patients by using video. Whether that video is recorded right there live by a provider or nurse, or even pre-created content from the hospital, the healing team now has the ability to educate patients and families right at their fingertips. In addition, patients can watch, review, and share videos easier with our newest patient and family share app. Families and patients get the exact same information without any gaps in communication almost immediately. Patients can ask questions and ensure they understand the information and feel confident knowing that they have this video resource at discharge. For critical care or NICU baby patients, this tool is a lifeline of communication with family members that cannot be there. We know patients don't remember, they don't understand. Oftentimes they're alone, and they're the ones re-explaining the information to their families. We also know that nurses needed more time. We had to make it simpler. We had to stop them from repeating themselves, and we had to provide them with more tools for custom education specific to the specialty that they're working on. We also know that nurses want to be trusted by patients. They want to take great care of them. And we know that the impact that this can have on HCAHPS, which is why hospitals that have used Medical Memory see a significant increase in HCAHPS and patient experience scores and reimbursements year over year. So let's talk about the tools. First, the Family and Patient Share app allows patients to pre-register their information, watch videos right there in the clinic, and share them with family members. Providers now can download the app on any smart device, can pre-record educational content, or they can also record live custom videos right there. How this works, patients come in, families come in, they pre-register, they're informed about Medical Memory, and when they do, they can get videos from the hospital right away. Some of our best hospitals are saying, hey, welcome to the ER. Here's some information about the pharmacy. Here's some information you should know about our hospital. The patients get this information right away, can watch the videos right away while they're waiting. So patients scan the QR code or go to the link to register, input their information, and they can watch those videos right there. They can also watch it on a computer with a web link and share those with family members. Now let's talk about the provider. Once the patient is pre-registered with the Family Share app, the provider only needs to click the date of birth and choose the patient name. Then they're able to record almost right away. The provider has the option to send those videos to the patient or use the video for in-office only, which is where the provider can access it, but the patient can't until the provider decides they're wanting to release it. They can also cancel it. So now we're also looking at click, go to be able to start recording any information for a patient almost immediately. So what are we recording? What should we record? Discharge and shift change tend to be the two biggest spaces that we see our hospital systems utilizing this. Shifts change, especially ICU, NICU, when the family members can't be there with the patient and they're wanting an update. They don't want to call. They don't want all that going on and on. They want one bit of information that the nurses provide. Discharge is also a huge space where the nurses and providers are recording the information that they're wanting the patient to have when they go home. We created these scripts with a few of our partners to give a very clear indication of exactly what should be recorded when they're being discharged. So the patient understands the information about the medication, and has the ability to access this once they've left the hospital. Well, I'm nervous to be on video. I'm scared about it. I don't know if I want to do it. That's fine. The tool also provides many different ways for patients to be informed about the information from providers. Whether that's just recording the patient and your voice, pre-creating content, recording the provider when they're doing their rounds or discharge instructions, or just recording the information sheet that you already provide and talk over it. All information is valuable. Even if it's just 60 seconds, the patient is better understanding and remembering the information that has been given. And again, Providers can pre-create content, pre-record videos, and create libraries that can allow nurses to better support patient information. One of the biggest spaces that we saw this being useful was with the pharmacy. Now, nurses have a library of medication-specific videos that they can share with a patient who has questions. That way, a patient can watch these videos and ask a pharmacist specific questions before moving on. Pharmacists can also record at their computer, not always bedside, the different in-house regimes that patients need to do. Patients are given the information and have the ability to ask questions before leaving the hospital. So everyone is informed about the medication. A huge questions on HCAPs where most hospitals get deemed. All with just a simple library of videos that nurses now have at their fingertips to send. And it's not just in pharmacy. There's a ton of different modalities and specialties that we're seeing huge traction in. Surgery is another big one. Pre-op, post-op, informed consent, how to get out of bed, how to heal. All of these places for orthopedic surgery, spine surgery, brain surgery, any of these places where providers find themselves repeating themselves over and over. Provide the nurses with tools to be able to educate patients about this information. The NICU, huge space that is being utilized. You can pre-create videos so that a mom can be able to watch before she leaves the hospital. You can record the baby live. When mom can't be there with the baby, if the baby's in the NICU, she's able to see updates, or family members are able to see updates from the provider or the nurse. And the NICU view percentage is huge, 1 to 17 times that these patients are watching these videos. They're feeling comforted by these nurses knowing that they have this information. And it's one of the highest in engagement that we're seeing across the board. Not only just in updates but also being able to say, here's how to breastfeed, here's the G2, here's different ways to swaddle. It's an incredible resource. So what do we do with those patients as they're engaged in our platform? We ask them questions. We can survey them. We can get to know more and provide that information to your hospital. We can ask a simple one question right as they're watching that video. There are longer options where they can click Take Survey and click 5 to 10 questions, and those resources, those information goes right back to you. You also can leverage a big ad space right next to the video for your medical records site, your health records place, anything along those lines. And what's awesome, we do not take IT's time. It's easy to scale. It's a downloadable app that's available on any smart device. So hospitals just have to be able to unlock it if they have hospital devices, download and be able to utilize. We are not taking up IT resources and IT support. We're able to be utilized right away. And so family members can download the app right there in themselves. Providers can download the app. And they call our team and our 1-800 number if they have any questions. Or they watch the training videos that we have right there, right available. I'd love to tell you more about how we're continuing to innovate, the things that we're doing in other hospitals, and start talking about how we can get a trial started in your facility.